If you've seen one critical access hospital, you've seen one.
As a leader in a rural hospital, you wonder if you're the only one sometimes.
But even in our differences, we're very similar.
The challenges that I face are the challenges that everybody faces.
There's quite a few issues that rural hospitals are facing nowadays. I mean, reimbursement levels is certainly one.
Professional staff recruitment.
Population health challenges.
Where are we in the grand scheme of other critical access hospitals in the state?
It's refreshing to get in a room with a group of people who shares those challenges.
That's great. You know, you're just not alone. There's people with knowledge and resources that you can tap into to make your life easier and your patients happier.
ICAHN is the glue that holds all that together.
With ICAHN, you can.
ICAHN makes a huge difference in healthcare in Illinois.
You know, before ICAHN came, we were all independent hospitals that didn't talk. ICAHN has brought us together to say, we're in this together. We're all critical access hospitals. In order to survive, we need to share ideas and thoughts.
And we started small, and we've grown now to over 50 hospitals strong.
Strength through collaboration entirely embodies ICAHN.
Collaboration's key, honestly, to our success.
Whether it comes from policies that people have shared with you so you don't have to reinvent the wheel.
It means putting all the right people in a room. It means asking everybody the same question and brainstorming the answer.
That means with all 52 hospitals, you have a little bit more influence in what happens both on the legislative, but also make it strong and successful for all of us, not just one of us.
ICAHN's leader, Pat, also is engaged at the national level.
It isn't just beneficial for the CEOs to be members of ICAHN. Leaders in other areas of the hospital, our lab, diagnostic imaging department, they all network with each other.
And through that, you become a better leader and you can learn from people who have been there far many years than you have.
Oh, ICAHN's done a lot with scholarships, grants, trainings. It's nice going to these vendor shows that ICAHN will host that you can learn about new stuff.
They're involved in so many different aspects of healthcare. And one of them that's helped us is recruiting new providers, because they have the expertise, they have the depth, the knowledge that, quite frankly, we just don't have.
Resources on compliance, on financial benchmarking, on quality benchmarking, on surveying of patients, all of those things that perhaps as an independent you'd have to figure it out on your own.
ICAHN has a listserv that I can post a question on the listserv and get responses from all 50 hospitals back and forth.
And get an answer within the same day.
The fact that I can tap into a resource network like this is invaluable.
One of the things that ICAHN helped us with was truly having the oomph to go out and put a CON together for a distinct part unit. We wouldn't have our Worthington Square Geriatric Psych Unit if it hadn't been for ICAHN.
ICAHN allows us to maintain our independence and be a true community hospital.
You got to join ICAHN.
With their leadership, their guidance, their expertise, it's helped us all.
ICAHN wants everybody in those critical access hospitals to succeed.
It lets us be industry leaders, it lets us be innovative, it lets us kind of brainstorm what we think the next move is for rural healthcare.
They're helping us be a better hospital.
With ICAHN, you can.
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 With ICAHN, you can.